Good afternoon. Thank you for joining us on Nationwide. Quite unusual, right? On a Saturday, you say. Well, we are aware unusual happenings around the world, but we're here to keep you updated. And I'm Ruth Aguele. We do appreciate you joining us. Let's begin with update on COVID-19. 25 new cases of COVID-19 have been reported in Nigeria, 11 in Lagos, 3 in Edo, 6 in Osun and 3 in the Federal Capital Territory. Now, 2 new deaths have also been recorded in Lagos and Edo states. As at 10 p.m. 4th April, there are 209 confirmed cases of COVID-19 reported in Nigeria. 25 have been discharged with 4 deaths. In the meantime, we hear of reports of 6 persons escaping from isolation center in Osun State. So let's join the Chief Press Secretary to the Osun State Governor, the person of Mr. Ismail Omikmidon, to give us a clear situation of what really happened. Mr. Omikmidon, can you hear me? Good afternoon.
Yes, I can hear you. Good evening.
Okay, so what is the true situation of what really happened at the isolation center?
Well, as at early this morning, news were flying around. Some persons allegedly escaped from our isolation center in Ijigo. Promptly, we moved into action to ascertain the veracity or otherwise of the claim. We carried out the head count, and after the head count, we realized that we could not account for one person. But as I speak to you now, the one person that we could not account for as 3 hours ago is back to the isolation center in the Jibo. So as we speak, all the 127 returnees from every are in the Jibo as we speak.
Okay, is there no security cover at the isolation center if such, incident could take place?
Of course, there is security around the place, but you agree with me that it is normal for people to feel agitated, having traveled all the way from every coast, and suddenly they arrive where they believe is their home, and you say they can't, access their home. I believe it was that agitation that probably led to what transpired. But thank God, the person is back and has started investigating to be very sure that all the persons she had contact with are traced to avoid what they call community transfer, because that was the reason why we had to quarantine 127 of them in the first instance.
Okay, I don't know. Can you also tell us, is the government contemplating relocating some of the returnees who are yet to test positive to COVID-19 to the NYC camp in Ede?
You mean those who have not tested positive?
Yes.
Well, for now, the facility we have can take those who have tested positive, including those who have not tested positive, especially the one in the Kibo. But what we have decided to do, in accordance with the protocol, is to allow those who have not tested positive to go while we monitor them.
Okay, aside monitoring, on a final note, are there other measures the government is putting in place to ensure that such a thing does not repeat itself?
Of course, immediately we did the head count and we realized what happened. Mr. Governor, His Excellency Abuja, has called for the beefing up of security around the area, and we have also ensured that we have sensitized the community enough to let them know that it is bad for them to accommodate any of the returnees from Ivory Coast, because accommodating them will mean allowing the virus to spread. So we are in touch with the community leaders, we are in touch with the traditional leaders and the political leaders, and they are all in support of the move that the government is looking at the moment.
All right, thank you very much, Mr. Ismail Moipidon. He's the Chief Press Secretary to the Osun State Governor. Thank you for that update. And Nigeria has received commendation from the UN Secretary-General, Antonio Guterres, who says he is impressed by the effective mechanisms put in place by Nigeria to fight the coronavirus pandemic. Now, the UN Secretary-General, in an interview, says Nigeria and other African countries have shown remarkable capacity to respond.
And I have to say that some of these developing countries have shown a remarkable capacity to respond. I was quite impressed to see, for instance, Nigeria, and Africa is of course a main concern of us all, Nigeria putting in place immediately in a stadium an hospital. And I saw difficulties in countries that are much more developed to do quickly the same. So there are efforts done by countries in the developing world that we should point, because they represent a very strong determination, but the resources available are, of course, insufficient, and the health services are usually extremely out of proportion with the needs of a pandemic like this. So massive support to the developing world is absolutely necessary.
The UN Secretary-General there commending the Nigerian government for putting in measures to fight COVID-19. And in Lafia, hundreds of people across Nasarawa North Senatorial Zone take home 20,000 naira each as the federal government implements cash transfer initiative to ameliorate the effects of COVID-19 on the vulnerable. Let's hear from Aliyu Tijani Mohammed.
Disbursement is starting with remote rural communities. More than 40,000 indigent persons across 6 local governments are expected to benefit. Amina Abubakar makes a list of the beneficiaries in Wamba and, like many others, appreciate the government.
I
thank God for them.
Officials remind the people on the rules to guard against coronavirus spread. The national coordinator of the conditional cash transfer, Tokpe Sinkai, assures Governor Slee of a transparent process in line with the presidential directive to bring succor to the indigent persons.
We are not just making payments alone, we are sensitizing beneficiaries on what COVID is, how to prevent COVID, how not to contact COVID, and all the safe spacing, hand washing, and everything.
Nasarawa government is also implementing strategies to reduce the impact of the virus on the people. In Lafia, Aliyu Tijani Mohammed, NTA News.
Still on COVID-19, the FCT enforcement team on COVID-19 has visited Kogi town, where the level of compliance of the stay-at-home directive is at the lowest ebb. Shoaibu Onoze Yakubu gives us a situation report.
The enforcement team visited Kogi town, where activities in the market is going on as usual despite the lockdown directive. This is aside the contravention of the social distancing measure in places of worship in the community. The team sensitized residents on the need to abide with the presidential directive for the benefit of all. Chairman of the enforcement team, Ikharu Atta, says Kogi residents must shape up or ship out. Meanwhile, the task force team decried the crowded scene at the entrance into Garki Market Friday morning, which is in contravention of the social distancing measure. For denying environmental officers from the Abuja Municipal Area Council access to fumigate the premises, the enforcement team on COVID-19 sealed up a bank in Season 5, Abuja. Although the bank has fully complied with the premises comprehensively fumigated by the government and certified fully healthy for habitation, and is now reopened for business. Shoaibu Onoze Yakubu, NTA News.
Well, situation report there at Kogi, but we have the FCT chairman, that's the enforcement tax team, the chairman, Mr. Atta Ekaru, to give us more insight on the level of compliance for FCT residents. Thank you for joining us.
Thank you, Ruth. Thank you, the NTA family.
Now, it's day 5 of the lockdown in FCT. What's the level of compliance?
Well, the level of compliance depends on district to districts here. I'm just coming here, actually where I'm dressed. I'm just coming in here from Kabusa district here. We saw Kuje yesterday. I can tell you that the level of compliance where NTA is located here, national headquarters of the NTA at Gariki, is almost about 97, 98%. The level of compliance at the Aso Drive, at Maitama, at Use, at some other very key areas around is very high, above 90% compliance here. As you go to Kubwa, you go to Karo, some other areas here is still around 70% compliance. When you go deep into the interior areas here, you find out that some persons in the interior are not seeing it as their own problem. I'm sorry to use that word here. They see it as an elite problem here, and so the compliance level in those areas appear to have been so reduced here. And some other persons really misunderstood the information coming in from the presidential COVID-19 team, where which said that market can reopen from 10 to 2 p.m. Even when clarifications have been made by the presidential COVID-19 team that these markets are largely neighborhood markets, not these conventional big markets here, like the one we have at Kuje, the one we have at Dusi Alahaji, the one we have at Kabusa. Everyone just troop into that particular market, particularly when this market have some neighborhood strength. People around the neighborhood coming to shop, do business in those areas here, and that also, some other persons today we met as well also misunderstood that. But I think the compliance level from my own perspective here is very encouraging in the city center. As you go down towards the suburb here, you start to find some areas where some persons, even for me in Kuje, those who came out were largely marketers and those who want to buy, but they are so crowded.
Yeah,
really,
we saw a lot of crowd there.
So crowd, there's so much crowd, and many persons here not keeping social distancing policies. But I think by and large, we were able to talk to them yesterday. You saw us there talking to them, and we hope that we could do that going forward here and limiting the amount of arrests we make, although arrests are always made daily.
Well, Mr. Ikaro, you agree with me that vehicles still ply the road, because I was caught up at the city gates this morning when coming to work, and a lot of vehicles are on the road, and it fringes at ease.
No, let me tell you why that is. The exemption list, because President Muhammadu Buhari really don't want us to suffer. So he made it in a way that the exemption list appears wide. Those who are in essential duties like the security agencies are there. The pharmaceutical ought to all open. You know that very clearly. Those who supply foods ought to all open. Those who are in some services like telecom, like others, ought to open.
So you're saying everyone is
Most of them needs to come out. The NTA staffs need to come out. That's the truth. NTA is large. Your staff need to come out here. But this NTA where we are and NHN10, they are all fully busy working and giving us detailed coverage of the COVID-19. They all need to come out. You can't dispute that here. But what we saw, which we are discouraging, is that some persons, particularly uniform men, who don't have any business at work, just come out and play around town. Today, we are able to arrest 2 of them. Many thanks to the Commissioner of Police for the FCT, Abalachi Roma, and his team working closely with us here, headed by Aziz Idowu. We pick up 2 men who are using their cars for taxi. Security men using their car for taxi. We pick them up and drop them up at the Wuye police station here. So that we can answer question there why they decide to engage in such lawlessness here. Then we had so many persons. But I think the movement we are seeing at the city gate, the reason why you see that little traffic of about 500 meters is because we need to filter out the genuine ones who ought to come to town. Those who are carrying foods, we allow them. From pharmaceutical, we allow them. Those who are journalists like you from NTA, from other stations, we allow them to come in. We filter them and we turn some back. You need to go home, go stay with the kids. Some of them who are not even in good, who are even carrying 2 passengers in front and so much at the back, we impound their vehicles. We book them at the DRT, as the VIO and the road safety book them, and we tow their vehicles.
Okay.
So most times when they are coming that way, we have to.
And tomorrow is Sunday, and I know there were these fears of places of worship not complying at the start of this lockdown, even before the directive was given by the Presidential Task Force. Can you share your experience with us?
Yeah. My experience have been very, very funny. I know we got some talk here and there, but I know what I told persons here, and I was very clear about it, is that we must try within all what we do to obey the government of the day. Because, like I said, that last Saturday when we actually had some church programs, we had to close them and send pastors and members back. We were very clear that there are biblical injunctions that says, look, you must obey the governments of the day. Romans 13, 1 and 2, we just opposed that with God choosing leaders in Daniel chapter, Daniel, we picked that up and told them this is what you ought to do. When we got to the mosques in the evening, we were clear. The Quran was clear. In Quran chapter 4, 59 and 60, that O ye who believe, obey Allah subhanahu wa ta'ala obey his messenger, and obey all those whom Allah have given authority over you. Obey them.
Okay.
Let's get this done. When we are done with COVID-19, we can. But for yesterday, we are all around the mosques, not allowing them. Even the ones in Kuje, we actually stopped on Juma. Those who have done ablution, we ask them, go pray. You must maintain your prayers, but go prayers, you are not here. Tomorrow, we will be going out in very many teams to actually look at compliance from the churches and telling them, please go home, worship with the family, pray unto God. You cannot be gathering here and define what we are doing. Look at case 31 in South Korea. Only one woman entered the church. 1,000 persons got infected with COVID-19. We can't allow that here.
All right, certainly. Thank you so much, Mr.
Thank you very much, Ruth.
Ekaro. He's the chairman, FCT Enforcement Tax Team. And we've been looking at the situation, the level of compliance for FCT. But let's join Michael Lale in Lagos, who would tell us what the situation is like. We hear the Murtala Mohammed International Airport, had an evacuation of American nationals and other happenings there. Michael?
Thank you, Ruth. The lockdown is effective in Lagos, only that scarcity is starting to set in. Now, to protect Nigerians from the spread of COVID-19, the federal government ordered the closure of non-essential businesses in Lagos and Abuja and now in Ogun State. Although operators of essential stores like food and drug are to continue rendering services to the people, Annie Daniels reports that one of the very popular fruits and vegetables markets in Lagos is witnessing scarcity of the item, just as Lagosians are full of hope of better days ahead.
Sabra Market, a home to all types of fruits and vegetables, has become a shadow of itself. The roads are deserted except for few pedestrians. As a result of the lockdown, security around the market environment has heightened, with security personnel on top of their game. Fruit sellers like Sanusi Salisu are now sitting idle, hoping for better days to come.
As the woman will buy this bread, I never pay. 2 weeks, I don't come for Lagos, I don't get anything. At the same market, I know me steals, I don't say anything. To send money now to my family now.
And for few traders that still have fruits to sell to the public, the prices of such fruits have skyrocketed. Respondents who declined speaking on camera attribute it to the lockdown in the state. It is, however, business as usual for newspaper vendors and roadside food sellers. Patronage is still high.
I came to buy paper to try to, know what's going on in the world. That these are people trying to eat, and of course you have got to eat. A lot of Nigerians is a cash economy. A lot of Nigerians they rely on going out and coming in for their daily bread. So they are trying to have catch their breakfast and all that.
Regrettably, though, social distancing seems to be very alien to these food sellers.
It's a big threat anyway. If you have to come from the medical standpoint, it's a very big threat. What you see at my back.
All my respondents agree that the desperate situation requires desperate attention, and their expectation is that with the steps taken by the government so far, COVID-19 will become a thing of the past, not just in Lagos, but in the whole of Nigeria. In Lagos, Annie Daniels, NTN News.
The Lagos State government has assured residents that it will continue with the distribution of its economic stimulus package to indigent residents to cushion the economic effect of the lockdown of the state ordered by the federal government. The State Commissioner for Agriculture, Bola Lawal, was speaking at one of the state-owned food banks in Agege. Nusausula reports.
The stimulus food package unveiled by the state government on the 27th of March comes in packs of raw food items to be distributed to every local government and local council development areas of the state. Governor Babajide Sanwo-Olu had earlier said that the Ministry of Agriculture will be collaborating with the Lagos State Residents Registration Agency in order to be able to reach the targeted beneficiaries. This, according to him, is to ensure fairness in the distribution of the stimulus packages. Meanwhile, residents have expressed mixed feelings over the government's relief package during the lockdown. Those who had benefited are appreciating the initiative, while those not yet reached are expressing disappointment for the delay.
We have received our own and we are about to share it.
I received the packaging given to us by the government.
We've been hearing and we've not even seen anything here. A lot of people have been talking about it around to the extent that we have to converge somewhere and to discuss about it.
Commissioner for Agriculture, Bola Lawal, assured residents that the ongoing distribution is not influenced by regional or political affiliations, as all distributing officers have been duly trained and instructed.
We'll continue to assure them that this is the first phase. They should just be calm. The lockdown is for 14 days at the first instance. Those communities that the food package did not get to, we are coming. Don't forget the fact that we have also collected the data of above 60 years of age.
The commissioner encouraged residents to adhere to the necessary protective measures against the virus and its spread. In Lagos, Nosa, Ustula, NTA News.
Those are the stories trending. More news after this break. Please stay tuned.
Many thanks, Michael. Let's look at more issues on COVID-19 from this end. Police water cannon trucks have been deployed to support the federal government COVID-19 decontamination exercise. NNPC 5 reports that the trucks will focus on disinfecting roads and other open spaces in the federal capital territory.
Now, it all began with the official flag-off of the decontamination exercise in Nigeria with a partnership between the Federal Ministry of Environment and that of the Federal Fire Service. That partnership is now extended to the Ministry of Police Affairs, where some trucks that were either to use as riot vehicles to disperse crowd are now incorporated into the decontamination exercise.
We will decontaminate the whole of FCT by the grace of God. And again, we are very concerned with high-risk areas like market, motor parks, which will all be done in the next 2-3 days.
The fighter trucks have shown the capacity to participate in the decontamination exercise. It's now time for action as they drive out into the streets of Abuja. NNPC 5 NTA News.
Many thanks, Onenge, for that update. Now, although there is no any confirmed case of coronavirus infection in Kano, the state government has designated 3 health facilities to handle emergencies. Abdullahi Mustafa visited one of the facilities, and here is his report.
As a major entry point to Nigeria, Kano is one of the states that are vulnerable to the COVID-19 pandemic. Therefore, various emergency response measures are being taken to keep the state and its people safe. In addition to closure of public offices, schools and boundaries, 3 health facilities have been designated to serve as isolation centers. The 70-bed capacity Kwanadawaki Isolation Center is one of such. This is one of the 2 rooms provided for isolation in the Kwanadawaki facility here in Kano State. And most of the rooms are equipped with all the necessary facilities, including ventilators, to prepare for emergencies in this period of coronavirus pandemic, which is continuously increasing across the country.
The COVID-19 affects the lungs, and in that process, the person may not be able to have enough oxygen in his system, the critical patient. So you have to have something like the ventilator that will aid the oxygen delivery to the lungs.
Also provided in the center are 13 mobile ventilators for ambulances. Another isolation facility is being set up at the main bowl of the Sani Abacha Stadium. This is through a collaboration between Kano State Government and a prominent son of the state, Alhaji Aliko Dangote. The center is expected to be ready within the next 1 week. In Kano, Abdullahi Mustafa, NTA News.
And from Kano, let's head to Kaduna to find out the measures taken in the fight against COVID-19 as we join Suleiman Abdullahi Rikachukun to give us an update.
Thank you, Ruth, and welcome to Kaduna. Governor Muhammad Badaru Abubakar of Jigawa State has appealed for strict adherence to precautionary measures to guard against the importation of coronavirus into the states. He made the appeal while receiving briefings from the task force on coronavirus. Muhammad Musa Askira reports.
Disturbed by the growing cases of the COVID-19 in the country, Governor Muhammad Badaru Abubakar charged the State Committee on Coronavirus Pandemic to do more and ensure that Jigawa State remains safe.
As you are aware, the world is in the entirety, is in a difficult moment. Women are facing existential crisis across the globe. This crisis caused by the COVID-19 pandemic has neither spared the developing nor the developed countries of the world. We must therefore come together to fight this scourge.
The governor, who commended citizens for compliance to the closure of the state's borders with the neighboring state, plus the weekly markets across the state to further reduce the chances for the importation of the disease into the state, also urged them to observe precautionary measures to avoid contracting the virus.
We pray that our state remains free of this dreaded disease. I, at this juncture, call on all and sundry to join hands in prayers and supplication for the recovery of those affected and repose the souls of those departed.
Jigawa State Commissioner for Health, Dr. Abba Zakari, stated that the 5 suspected cases recorded in various parts of the state last week tested negative. Governor Muhammad Badru Abubakar was taken round the newly established Infectious Diseases Center, which is equipped with the necessary facilities to serve as isolation center in Dutse, the state capital. Meanwhile, the State Committee on Coronavirus has commenced the fumigation of public places in major cities across the state. From Dutse, Muhammad Musa Askira, NTA News.
In the same vein, Governor Aminu Bello Masari of Katsina State has ordered a census of returnees from other parts of the country and abroad as part of measures to check the spread of coronavirus in the state. Governor Masari gave the order during an emergency meeting with the leadership of Christian community in the state. Awal Haliru has the details.
Was called to review the implementation of the issues discussed during a similar meeting convened last week. The State Deputy Governor, Secretary to the Government of the State and the Commissioner for Health briefed the meeting on the steps so far taken to contain the spread of COVID-19 in Katsina. Governor Aminu Bello Masari also directed the Secretary to the Government of the State to set up a committee with membership from various women's groups to enlighten the women in their homes on preventive measures against the coronavirus pandemic. The State Deputy Governor, who is also the Chairman, Emergency Response Committee on Coronavirus, said more donations are being expected from individuals to fight the spread of the pandemic.
And with that report, Nationwide continues with Roots in Abuja. Good afternoon.
Thank you, Suleiman. Kebbi State government has appealed to media practitioners to put integrity and professionalism above other considerations in their reportage of any activity that affects the public, particularly at this moment of global struggle against the spread of COVID-19. Chairman Task Force on COVID-19 in the state, Jafar Mohammed, stated this in Birnin Kebbi. Shehu Usman Abdullah reports.
The State Chairman COVID-19 Task Force Committee, Alhaji Jafar Muhammad, refuted a claim by a newspaper that Kebbi State is among the states in the country that have no single ventilator to support critical cases of coronavirus patients. The chairman said Kebbi State has 2 functional ventilators at the intensive care unit of Sayahaya Memorial Hospital and is leaving no stone unturned to prevent the spread of the disease in the state. Alhaji Jafar similarly appealed to newsmen to always clarify information to ensure its authenticity before feeding it to the public.
I therefore want to use this medium to categorically debunk the report and also state that we have 2 number functional ventilators, as you can see practically in our intensive care unit.
The Permanent Secretary, Ministry of Health and Chief Medical Officer, Sayahaya Memorial Hospital, Dr. Aminu Haliru Bunza, said the ICU in the hospital is capable of handling patients that require respiratory support. Dr. Yakubu Muhammad Sani, an expert on the respiratory support machines, briefed newsmen on the function of the machines, pointing out that a patient only needs a ventilator when the lungs no longer produce adequate oxygen to the body. In Birnin Kebbi, Usman Abdullah Shehu, NTA News.
And from Birnin Kebbi, Badon is next stop for us on Nationwide as we join Kemi to give us a situation report from that end. Kemi?
Thank you, Ruth, and welcome to Ibadan. The detection of COVID-19 goes beyond
Temperature measurement, which is always one of the steps apart from the symptoms, which could influence suspicion. In this report, Rofia Animation Badmos takes a look at the process beyond the initials in Oyo State. That the spread of the virus is contained.
The state has some facilities that is being used as we speak.
A visit to Virology Department, College of Medicine, University of Ibadan shows that the processing of COVID-19 tests is open to any suspectable person, and the center covers 3 states in the federation.
When doctors suspect in a clinic or different hospitals, their helplines, numbers of federal state ministry of health that they will call, and they will assess this patient if they're eligible or in the suspect category.
As you can see from the graph, over time, and then you will now see if it's going to be positive, there's going to be a peak. You now see the amplification rising, and then you can say, oh, okay, this sample may end up being positive.
This room is believed to be the cleanest room in PCR. It is where the test for COVID-19 begins. In Ibadan, Rofia Animation Badmos, NTA News. Customs officers have been charged to be vigilant and be alive to their duties at border areas to check activities towards curtailing the spread of coronavirus pandemic. The controller of customs, Oyo and Osun Command, made this known during a tour of border areas in the states. Correspondent Shola Wahid tells us more.
Following the outbreak of COVID-19 and its spread globally, the federal and state governments have taken several measures, including border closure, to prevent the people from contracting the virus in the country. Comptroller of Nigerian Customs Service, Oyo Osun Command, Ngozi Uche, toured Ibeti, Shaki, Kishi, and other border areas within the command and mandated officers to be vigilant and increase screening of people and goods at border entry points.
We have to take precautions. We have to be proactive. We have to be ready to fight it back. The way Ebola came and left, the same way this one will still go.
They advise the people to adhere strictly to the directives of government and improve on their hygiene. In Ibadan, Shola Wahid, NTA News.
Oyo State COVID-19 Task Force team has reaffirmed that basic operational activities will soon commence at the State Infectious Disease Center, Olodo in Ibadan. The acting chairman of the task force, Professor Temitope Alonge, made this known while conducting journalists round the facility. Kayode Oladoshu has the details.
The level of work at the Disease Infectious Center indicated that operational activities will commence as promised by the State COVID-19 Task Force. The center, which has 100-bedded space for both male and female patients, coupled with other facilities, is expected to provide medical treatment for coronavirus pandemic.
Training is going to commence for the healthcare workers who are going to work here. And once I'm through with training, I have my borehole, I have water supply, I have electricity, I have solar powering, I have the ICU beds being installed, and I have the oxygen pipes being laid. I am functionally ready.
Although no new cases were recorded as at the time of this report, however, the acting chairman of the team confirmed that 1 out of 8 coronavirus patients in the state has been discharged.
We have only 8 cases that were positive. 1 has been discharged. 2 of the clients have done exceptionally well and hopefully will, repeat their test again. They tested negative after the quarantine period, and the remaining 5 are in excellent health.
In Ibadan, Kayode Oladoshu, NTA News.
An update on Kayode's report says Oyo State now has confirmed 9 cases of COVID-19. And that's it from here, Ruth. It's back to you.
Thank you very much, Kemi, for that. And let's get more insight about this coronavirus that we'll be locked down with. We have a public health physician joined us in the studio, Dr. Damian Bai. Thank you so much for joining us.
Thank you.
Well, coronavirus is still here with us. There's nothing we can do for now. But of course, the precautionary measures is what people have been told to follow. So just on your perspective, what should people know now?
Well, it is important that people continue to follow the directives as given by the Nigerian Center for Disease Control. It is these little things that we need to do that will prevent the COVID-19 from exploding in Nigeria. The little things that we've been talking about has been social distancing, keeping away from your neighbor, at least 2 meters apart, just like we're sitting. And if you have cough and you want to cough, you cough into an elbow or into a tissue paper covering your face or handkerchief. We also are saying that it is very, very important for us to continue to practice good hygiene, washing of our hands with soap and running water for at least 20 seconds. In places where you do not have soap and running water, you use alcohol-based sanitizer. And we see alcohol-based, but not just alcohol. The sanitizer,
yes, because we see people using alcohol.
70% of alcohol in the sanitizer. Avoid crowded places. That is why there is this lockdown presently. It is very important that we comply with these instructions. Because if we look at what is happening in the United States of America, in Italy, in Spain, it's because they did not adhere to these instructions early. Our health system is not as strong as theirs. So if we do not adhere and we have this large number, the explosion on our hands, it will be very difficult for us to cope.
And a lot of people, from reports we're hearing, still doubt the potency of this disease. Now, most people just believe when they use the face masks, they're protected. What is the 100% assurance of the face masks?
Well, in science, there's nothing that is 100%. But again, recent studies, you know that in the United States of America, initially, they were saying that people should not use face masks. But just yesterday, they now said that, please, evidence has now shown that in countries where the general population use face masks, especially when they're going out, the disease has been able to be kept at a low. So the advice now is for people who are going out, especially in crowded places, to use these face masks. But they must use it the correct way.
Now, for people who are at home, Dr. Bai, because of the lockdown in some states in Nigeria, what would you advise? Even as we're at home, what should we do differently to ensure that we're safe at home and not just staying at home doing nothing about it?
Well, it is staying at home. Again, we have to continue to tell our children to wash their hands and ourselves to wash our hands with soap and water. Some people have used this opportunity of a lockdown to visit friends and around where they
neighborhood.
Live. This is not the thing to do at this point in time. I've seen people or young adults and children gather to play football. Again, this is not the right thing to do. It's not safe, right? It is not safe. Yes, we encourage people to have some form of exercises, but these exercises is not the ones that will bring people together. Do it on your own or just within your family household.
Okay, lastly, Dr. Bai, before I let you go, we've seen trending videos of hand sanitizers, some that are not original. What would you advise people on how to differentiate which is real and which is not?
Well, we want to believe that the labels on sanitizers are correct. So if the labels are correct, every person who is getting a sanitizer should look at the alcoholic content of the sanitizer. If it is not stated, please keep that aside. However, the key thing and most important is washing of hands with soap and running water. It's only when you do not have soap and running water that you resort to the use of sanitizers.
Thank you very much, Dr. Damian Bai. He's a public health physician. Thank you for giving us insight on how to manage this COVID-19.
Thank you very much.
All right, let's look at more issues on COVID-19. Following request by the Presidential Task Force on COVID-19, INEC has released about 100 pickup vans from the Commission's fleet to be deployed for contact tracing, surveillance and infection control in Kano, Lagos, Osun, Oyo, Rivers and the Federal Capital Territory. A statement by INEC National Commissioner for Information, Festus Okoye. The Commission is working with the Nigerian Communications Commission and Telecommunications service providers to assist in raising public awareness of the pandemic by sending bulk messages to registered voters, as well as discussing with the Ministry of Humanitarian Affairs, Disaster Management and Social Development on the possibility of using INEC electoral registration areas, wards and polling units nationwide as locations for the distribution of palliative and other relief materials to citizens. The Federal Road Safety Commission has once again reminded motorists to comply with the social distancing directive and avoid overloading. Court Marshal Boboye Oyemi advises motorists, even in areas observing the presidential directive on the lockdown, to comply with all public health tips given by the Presidential Task Force on COVID-19. And as part of commitment made by the Nigerian oil and gas industry, the Nigerian National Petroleum Corporation and joint venture partners are donating an isolation center with 190 beds capacity as part of its 21 billion naira past for the fight against for the fight against COVID-19. Secretary to the government of the Federation, Boss Mustafa, who inspected ongoing work at the facility, commended the industry players for the intervention while reiterating government's resolve to deploy all instruments to curtail the spread of the virus. Let's hear from Lydia Sampson.
The NNPC and its partners in the upstream, downstream and services sector launched an industry collaborative initiative in support of ongoing federal government's effort to curb the spread of coronavirus in Nigeria. The key players say the ongoing reconstruction of this day dome, a popular event center with 190 beds, is in line with global trend for preparation.
On behalf of the oil industry, on behalf of NNPC, I hereby hand over all the ambulances that we've been able to put together. We are still getting more. This is an ongoing effort.
We are not praying to get to that, but we must prepare. And there is nothing like over-preparation in this regard. I believe it is better that we get prepared and get over-prepared than not to prepare alone.
The Group Managing Director, NNPC, Mele Kyari, says the total commitment to the initiative is now 21 billion naira, which will be donated in kind. NNPC and partners have streamlined the program for the distribution nationwide.
Hope is that we will never need this. If it does come to a situation where we need it, this place will be adequate and available to house 190 patients at any one time. And we're also happy to say that the industry, oil and gas in particular, are donating about 121 billion naira now from the 11 billion that we announced last week. And they're all going to be in kind. The companies are going to use their own procurement processes to bring this on the table.
The construction companies, CCECC, we have RCC, so all the construction companies are coming together, whilst we in the oil sector will try and be the catalyst to quicken the process and at least put things together.
Already, 5 ambulances by a leading NNPC joint venture partner, ITU Exploration and Production Company Limited, was handed over to the Secretary to the Federal Government and Chairman Presidential Task Force on COVID-19. Another NNPC facility in Utaku is also to be made ready in the next 2 weeks with another 60 beds isolation center. In Abuja, Lydia Sampson, NTA News.
All right, let's look at what filling stations are up to in Kogi. Petroleum marketers in Kogi State have been warned against creating artificial scarcity of the product and non-compliance to the new pump price. Coordinator of Sokoto Field Office of the Department of Petroleum Resources, Mohammed Makera, gave the warning while monitoring some filling stations in Brindin Kogi to ascertain reasons for long queues. Let's hear from Nura Tonko Wakili.
The Department of Petroleum Resources was in Kogi State to monitor compliance with the emerging regulatory frameworks and price modulation by the federal government in response to COVID-19 and its effect on global economy. This will guarantee availability of the commodity at affordable price in Kogi State and contain possible sharp practices by marketers. In all the filling stations visited in the state, the long queues have disappeared and the commodity is sold at the government-approved price.
So far, so good. All where we have gone to, all the filling stations visited, they are selling at government-approved price, that is 125 naira per liter. And you observe there is no queue. everywhere we go, with maybe exception of this particular place, and this place is something else.
Muhammad Makeda said the department will sustain the inspection throughout its areas of operations. He urged people to shun panic buying as the country has the commodity in stock that can last for 60 days. In Birnin Kebbi, Nura Tanko Wakili, NTA News.
And from Birnin Kebbi, we're heading to Maiduguri to join Mohammed Ibrahim to tell us the steps taken to stem the spread of COVID-19. Mohammed?
Thank you, Ruth, and welcome to Maiduguri. Women-led civil society organization has embarked on sensitization and awareness campaign on coronavirus at vulnerable places in Maiduguri. GSM markets and IDP camps were some of such places visited to kickstart the campaign in Borno State. Pauline Kujevana reports.
The sensitization by the main network of women-led civil society organization became imperative considering the fast spread of the pandemic coronavirus around the globe, bearing in mind that internally displaced persons and markets such as the GSM market are vulnerable. The women took turn to sensitize and enlighten the GSM operators on hygiene, mode of transmission, and what to do should signs and symptoms of COVID-19 show fixed. Similar exercise was carried out at Teachers Village IDP's camp, where the trial asked the people to convey same messages to their neighbors and friends without creating confusion and panic, but to strengthen their awareness and prevention.
Many, as we be coming in and going out, they'll be able to wash their hands, they'll be able to sensitize their hands. Peradventure, if the virus landed in Maiduguri, we have the willpower to control it and to take care of ourselves.
We would continue on our advocacy journey as we have been doing to ensure that everybody across Borno State knows about this pandemic.
The women-led group donated soap and hand sanitizers, in addition to installation of hand-washing facilities at the entrance. In Maiduguri, Pauline Kujevana, NTA News.
Business owners have taken aggressive preventive measures against coronavirus outbreak with the provision of hand-washing facilities. Again, Pauline Kujevana was at Monday Market and other major business points to assess level of compliance.
The provision of hand-washing facilities at the entrance of business arena is great intervention to reduce harm from the spread of the coronavirus. Similar preventive measure was put in place at the 16th entrance of Monday Market, a development buyers and sellers site are happy with.
Shi abun yazo gari addu'a da kuma hadin kai ma gwamnati. Komi mai wucewa ne, wata rana zai wuce. Kuma mun gode wa gwamnati, mutane kara wannan abun ya shafe su ne, aka kawo wannan abun.
Abin da suka yi yayi kyau, amma makamin wannan abun addu'a.
It's a very good initiative to encourage neatness, and this disease cannot spread.
When I saw it, I was so impressed. That's a very nice move.
Marketplaces seem vulnerable to contact coronavirus due to body contact, exchange of money and goods. So, preventive measures such as this is imperative. In Maiduguri, Pauline Kujevana, NTA News.
That is all from Maiduguri. It's back to Ruth in Abuja.
Thank you very much, Mohammed. Let's look at its day 5 lockdown in the FCT. So let's find out the situation report. The FCT COVID-19 enforcement team has reiterated its commitment to ensure that FCT residents comply with the directive of the lockdown to curb the spread of the deadly coronavirus pandemic. Hawa Yimba was on an entourage with the team and now brings us an update.
At Kabusa, a suburb in Abuja Municipal Area Council, the market was busy with traders going about their normal business. Team leader Abdulaziz Idowu, while educating them on the need to comply with the stay-at-home directive, advised them that they should stay at home rather than roam the streets.
If you look at your number now, you are too many. You are here to buy. And at the end of the buying,
Chairman FCT Task Force Enforcement Team Ikairo Atta emphasized that they will not relent in ensuring compliance.
Here we are now at the moment, neighborhood is the crowd. People who are here are those who are buying from here. And largely we don't see too much of vehicle. They all trek from their house to the market. And the market is sadly overcrowded here because it's a crowded and congested neighborhood here. And in all of this, we are trying to sensitize them to call their senses to remember to understand that COVID-19 spread easily in an area like this. We try to even say, look, let's look at social distancing. How can you distance them here? They are already overcrowded here. Look at the noise behind here. When they have been asked to please disperse and go far, they are already feeling very bad about it here.
The FCT task force team, while intercepting motorists, ensure that the drivers do not accommodate more than 3 persons in their vehicles. Hawagimba, NTA News.
All right, let's head to Benin to find out the situation report there on the spread, on the containment of the spread of COVID-19 as we join Agatha. Agatha.
Thank you, Ruth. A warm welcome to Benin. Ondo State government has confirmed first case of positive coronavirus in the state. The state governor, Oluwarotimi Akeredolu, said the victim is in isolation and all his contacts are being traced. Doris Olumoko will now take it up from here.
Now, thank you very much, studio. This is the infectious disease hospital located along Igbato Road in Akure, Ondo State. Here, the only index case is being managed. I have here with me the Chief Medical Director of this hospital, Dr. Busari Ismail.
The index case we have is doing possibly well in the ward. We don't have any means to be having panic about the case. The vital signs are stable. We have enough medical personnel that's in place.
Earlier today, the governor of Ondo State, Mr. Oluwarotimi Akeredolu, addressed newsmen.
One of the reasons is to allay the fears of our people. We want you to believe in yourself and believe in us. There is no fear, there is no cause for fear.
Now, immediately the news of the reported index case in Ondo State went to town last night, there was apprehension. I also spoke with some people.
When we heard the news, we calmed down because already people will be told that everybody should be calm and observe the hand washing and hygiene.
We try and appeal to the state government to take all necessary measures to try and contain this virus.
That'll be all from here in Ondo State, and it's back to you in the studio.
For that situation report. Now, Edo State is one of the 14 states in the country with confirmed cases of COVID-19. Since the discovery of index case on the 24th of March, the state government embraced a raft of measures to curtail spread of the scourge. Good luck in Naini. In this report brings us up to speed on the situation in Edo State.
Operation of a 35-man COVID-19 committee chaired by the state governor, which meets regularly to review outcomes. The state government ordered a partial lockdown, which includes the closure of schools and markets, except for traders selling food items. It also bans social gathering of no more than 20 persons, urging the people to observe social distancing. However, investigations reveal that compliance is low.
As some people are still trading commodity other than food items and other essential items that is approved. This for us is unacceptable.
I do not advocate a total lockdown. I advocate restriction of movement, restriction of gathering, which is what we have for now.
In addition to the 3 isolation centers put in place by the state government in Benin City, Irwa and Auchi, expansion work in the Stella Obasanjo Hospital to accommodate more patients is ongoing. This is to provide a total of 280 beds in the isolation centers. 25 ventilators have been procured, bringing numbers of ventilators in the state to 28, as 10 intensive care units now exist to take care of critical cases.
So the mandate is to get all the services currently going on at the Stella Obasanjo main hospital and relocate personnel and services to the Edo Specialist Hospital.
Over 450 healthcare Professionals from public and private institutions have been trained on how to handle cases. Similarly, over 100 screening points across the local government areas made up of teaching hospitals, general hospitals, primary healthcare centers, and private hospitals have been established. With record of 7 cases in the state, according to the record of the NCDC, Edo State government has signed the quarantine regulation made pursuant to Section 8 of the Quarantine Act, the Public Health Law, and other legislations as the state firms up its response framework to the COVID-19 outbreak in the state. In Benin, good luck in INEC, NT News.
That's it from here. Back to you, Ruth.
Thank you, Agatha. Let's look at some felicitation. President Muhammadu Buhari felicitates with renowned academic and prolific writer, Professor Olufemi Obafemi, on his 70th birthday, congratulating him for a distinguished career and contribution to nation building. A statement by the Presidential Advisor on Media and Publicity, Femi Adesina. President Buhari believes the scholar's willingness to accept invitations for national service and make available his vast experience and wisdom remains commendable, especially in strategic places like the National Institute of Policy and Strategic Studies, National Commission for Museums and Monuments, and some of the nation's universities. As former president of Association of Nigerian Authors and the only recipient of the Nigerian National Order of Merit in the Humanities for 2018, President Buhari strongly extols Professor Obafemi's passion for research, creative spirit, and organizational skills. President Buhari wishes him longer life, good health, and more strength to keep serving the nation. And next is sports with Olumide Eguntola.
As the federal government lockdown initiative to stop the spread of